So certainly, I think I'm yet to have, no, I lie to you, I've had one person who came in the last 15 years who I didn't think needed to come for a bike fit. And she's one of the few people who've ever been not particularly happy with what I did, because her son was into cycling, his mother was overweight, he bought her a bike fit. She came in, she didn't want to be there. I did everything I could to sell it for an hour to her, and in the end it didn't work. But listen, performance pain, placebo, up to 7% improvements with placebo. Peace of mind. You know, I do get some people coming in who say, listen, I've got no pain, I'm riding pretty well, I just want to know, am I in a decent position here? And very occasionally I'll someone come and go, I just can't argue with this position. You know, I said, listen, I'm happy for you to go away, we can sit and have a coffee, or why don't we talk about something else? I'm a physio, let's have a look at the rest of the body. And you know, we generally can build up an hour fairly quickly there. Now, the interesting thing about position, and this next comment I'll make, and I've stolen this off my mate Phil Burt, who is the Sky team's physio, and he talks about micro-adjusters and macro-adapters. Some people, if they're not within millimetres of the right position, they'll get niggles, they'll get pain, they won't get the most out of their bike. Other people put them on any bike in any position, I'm sure you know people like that, these robust people who just don't break and seem to do well on whatever bike they're on there. And the two extremes of that in the Sky team are Mark Cavendish and Geraint Thomas there. And Cav, if he's not within a millimetre, he'll pick his bike and go, there's something wrong, and he'll take it back and they'll measure it and go, yep, you're right. No, sorry, you're a millimetre too far forward, whatever there. Thomas on the other end of the spectrum, 2 years ago at the Tour de France, riding a mountain stage, bike mechanical issue there, they swap bikes, somehow they give him the wrong bike, saddle's 30 mils too low, he rides 200 k's in the mountains, finishes top 10, didn't even know he's on the wrong bike. So you'll get that either end of the spectrum there, and you'll probably know whether you're that kind of person or not. If you're the person who never had a tendon problem and that sort of stuff, but you know, there's sort of things there. But listen, I think there's always value in getting one of these things. And if you've got no injuries, it's about performance and efficiency, and that still got to run afterwards. We'll keep saying there. Comfort versus performance. Once again, what I say again and again, my expertise and what we do as physios in bike fitting is the understanding of pathology or stiffness or particular issues and how we can get around that to make your body work on a bike. Or classically, we've seen quite a number of people coming in off a particular fitting system that I won't mention with a lot of what we call posterior chain pain. Back, glutes, hammy, sciatic nerve irritation there. And as soon as they start telling me that story, I know exactly the position I'm going to see them in there. We're classically too high and too far back, and then too aggressive at the front, and they get sore. And it causes injuries. And for some people, we had a bit of a bunch from last year who a number nearly missed going to world champs because they were put into a bad position. So, you know, a bad position repeated lots and lots of times can cause lots and lots of problems there. Now, we're here particularly to talk about the last 6 weeks. Now, we're 6 and a bit weeks out. As much as I'd love everyone to come in the next 6 weeks for a fit, because it'll be good for my business, it's not really what we want to be doing. So, really, I'm a firm believer that particularly with people doing high volume training, which hopefully most of you are if you're doing the half Ironman, in a perfect world 6 weeks, at a pinch I'm happy to do a fit 4 weeks out there. If I get people coming in closer to that, we're asking big questions about where are we compromising. Now, the time I do want to see someone close to a race is if an injury comes on. Whether it's an injury on the bike, a crash, something like that's happening, that's stopping you being able to ride comfortably in the right position. It's like, how do we modify that position for the injury you've got? It might be a running injury, it might be a swimming injury, it could be anything there. How do we modify you out of that? But things that you can do, and same thing, we want you to be able to go home with a few ideas from here as well, is, you know, ask yourself if you start getting sore on the bike, what's changed? James talked a lot about the changes in training load there. You know, have you suddenly cranked things up? Are you getting sore just because you jumped up? Well, treat it like a bit of an acute irritation there. Back off for a few days. Maybe it's the time, if you haven't torn a muscle, to use some anti-inflammatories. If it's an irritated joint, your back's got a bit sore because you've just overdone it there. Thinking about that. Have you changed your equipment? Beware, my little alarm bell always goes on when I start asking people questions. So what have you done new? You know, no different to these overuse injuries. It's so commonly that it's a training error we diagnose it as. The cause is overtraining, wrong training. I haven't changed anything. I'm doing the same cars on the same bike. I haven't changed for a fit. My next question, when did you last have a service? Any bike shop owners or mechanics in here? Good, okay. Yeah, listen, and I'm not here to bag them at all, but bike shops are traditionally terrible at putting your bike back where it was before. If you've got a bike, you're comfortable in that position, it's going for a service anywhere in the next 6 weeks, put a big bit of tape around the saddle height, put a big bit of tape around the seat when it goes in, say, please don't touch my saddle or my seat. Because the amount of people, and there's people I've fitted before, I haven't seen for 2 years, they come on the same bike, I say, don't know what happened, I'll pull my measurements out from 2 years and I go, yeah, your saddle's 50 mil low. And it might be only 10 mil low, but for some people that's enough, repeated 300k a week, that it'll overload a knee or a back or whatever it can be there. So we just see it again and again. So that's just a good little thing just to keep it in the back of your mind. So if you can't work out anything else that's happened, ask someone else who might know more. Whether it's a coach, health professionals, once again, I think, you know, we talk again when we're dealing with strength conditioning coaches, people like that, there's always to me a line in the sand. And if there's pain or injury, the line that's the sand, it's a health professional's job to be involved one way or another to help you out with this. If it's just about performance and strength and speed, there's no pain, I think there's a reasonable argument to be dealing with performance coaches only. But in a perfect world, there's a team of people you work with who communicate to each other and are able to help put all that together there. And then if you're going to make changes, what are you trying to achieve? First question. How do you think the change you're going to make is going to help? And I guess that's what I see again and again when people have been given a bit of a run around because they're sore and they've gone back to their bike shop or they've got a mate who knows something about them, and they sort of make changes hoping it's going to help. And sometimes it does. The difference to what we do, I guess, is we go through, we ask all the questions, we look at your body, we make a diagnosis of the problem. Because we understand the pathology, we go, okay, we know that because this is an Achilles tendon that you've flared up on the road, we know we don't want it on too much stretch. How do we change the stretch of the tendon on a bike? We modify cleat position, we change saddle height, we change forward and aft position there. So we work around it in that direction there. So if you are going to make changes, and you are one of these people who needs to do it yourself, make them one at a time. Be analytical about it. Change one thing, ride the next day, say, right, what did it feel like today? What did it feel like tomorrow? Classic thing about tendon pain, it won't hurt today, it'll hurt tomorrow. Okay, so those little training diaries with next day pain scales and that are really, really good for you to add in or keep it on your phone or wherever you keep a nice diary there. And you know, once again, if in doubt, time's against you, seek professional help. And as I said, I don't like doing bike fits in the last 6 weeks, but I hate it even more when I hear that someone's been going well and they get injured in the last 6 weeks and I don't do anything about it there. So that's when we like to get involved there. Now, I always like to talk about these sort of things, and I've done a number of different lectures and we get bigger and better there. So, listen, I guess whenever I go down a bus, I'm classically interested in the different positions people ride in, particularly with the pretty good information around now that hopefully helps people get in the right position. So, crime number one, I really hate it when I see people on a beautiful time trial bike that's got the potential to be ridden really, really well, and someone set them up in a road position. Okay, and very, very basic kind of stuff. So, road position is about power production. It's a squatting position. You're sitting back on the saddle with a long lever. How far forward you go is a product of how flexible you are in the hips largely and what your back's like there. It's not very aero because you're rotating through a peloton, and you know when you go to the front, you tuck down and you can hold there for a little while there. So 70+% of weight on your bum. Time trial, and we go from here to here. Okay, same knee angles, same angles around the ankle as well. The hips become more open, our weight goes onto our arms. I actually haven't closed my hips at all, and it's a lot of misinformation. A lot of people go, I'm not flexible enough, I can't ride a time trial bike. And there's a couple of guys in the room we've had these conversations with there. And it's actually the opposite. If you're inflexible, you'll go better on a time trial bike. Okay, and I'll show you a pic of the other, even worse one that I see than this is, and I see it again and again, how many people in here have got road bikes with time trial bars or clip-on bars on them? Okay, a few. Listen, I see injuries. I mean, I love them. They're great for physiotherapy. We just get injuries again and again. There's that small percentage of people who are unbreakable, fabulous flexibility. For whatever reason, the geometry of the bike works okay with it, but you're always compromising on that sort of stuff in there. And I just love this pic of Macca. Okay, it looks like he's on the phone to his girlfriend while he's riding at 40 odd k's an hour through Kona. And obviously he's a supreme athlete with beautiful flexibility, but this is the right size bike in the right position for him there. Hips are open, relaxed across the front, you know, ride a lazy 180 k's in 4 hours 15 or something like that. So, you know, it really is important.